Hello, welcome to Better Health. I'm Dr. Russell Ficara. Our purpose here is to share health tips so you make better informed decisions. So enjoy the video. Take care.
Does fasting really help psoriasis? And what does the science show? Psoriasis, a chronic autoimmune condition, affects millions worldwide. Today we're delving into how fasting might play a role in managing this complex skin disorder. So what is psoriasis? Plaque psoriasis is a chronic autoimmune skin condition characterized by red, scaly patches caused by excessive growth and turnover of skin cells. There are 5 types of psoriasis, with plaque psoriasis being the most common type at 85 to 90% of cases. So that will be our main focus here, but you can have more than one type at the same time. About 3% of the population suffers with psoriasis. It can affect anyone, any age, any gender, and any skin color. It is influenced by immune dysfunction, genetics, and environmental triggers, including diet. In studies of twins, if one twin has psoriasis, the other twin has a 3 times more chance of also having it. So genetics is a factor. While conventional treatments often focus on topical therapies, immunosuppressants, and biologics, there is growing interest in dietary strategies, especially fasting and intermittent fasting, as complementary approaches to managing psoriasis. Could these metabolic interventions reduce inflammation and improve skin symptoms? Let's take a closer look. Psoriasis is driven by an overactive immune system, particularly involving T cells and pro-inflammatory cytokines like TNF-α IL-17 and IL-23. These inflammatory molecules stimulate skin cells to proliferate rapidly, leading to the hallmark lesions. Managing systemic inflammation is therefore a key component of psoriasis treatment. Fasting, whether prolonged for 2 or 3 days or intermittent fasting, such as only eating between noon and 8 p.m., triggers a cascade of biological processes that may positively impact psoriasis. These processes include reduced systemic inflammation. Fasting lowers levels of inflammatory cytokines and acute phase reactants like C-reactive protein or CRP. Next, it improves insulin sensitivity. Insulin resistance, which is often seen in psoriatic patients, exacerbates inflammation. Intermittent fasting can improve insulin sensitivity and reduce metabolic stress. Next, fasting stimulates autophagy, a cellular cleanup process that helps remove damaged proteins and immune complexes that may trigger autoimmune reactions. And finally, the most important aspect, fasting helps to restore a healthy, balanced gut environment for the friendly gut bacteria, which in turn reduces inflammation. Several clinical studies and anecdotal reports support the potential benefit of fasting in individuals with psoriasis. One natural model for intermittent fasting is known as Ramadan fasting. This is when, for example, Muslims abstain from food and drink from dawn to dusk during the holiday. Studies in 2016 and 2022 both evaluated psoriatic patients observing Ramadan. Researchers in both studies found a significant reduction in the psoriasis severity scores after the fasting month, so fasting improved their psoriasis. Another study included intermittent fasting for severe psoriasis. In a 2020 report published in Case Reports in Dermatology, a 36-year-old man with severe plaque psoriasis adopted a time-restricted eating regimen, eating only between 12 p.m. and 8 p.m. daily. Over 3 months, the patient experienced marked improvement in skin lesions and energy levels, without using new medications. His blood markers for inflammation, including CRP, also declined. Another study included alternate day fasting for psoriasis. This case involved a 48-year-old woman with moderate psoriasis and metabolic syndrome who followed an alternate day fasting protocol for 12 weeks. She lost 15 pounds, lowered her blood glucose and CRP levels, and saw a 50% improvement in her PASI score. Her skin improvement correlated with reduced systemic inflammation and improved gut microbiome diversity, a known contributor to autoimmune skin disorders. Emerging research supports the role of the gut microbiome in skin health. Psoriatic and even IBD patients often have gut dysbiosis, which contributes to systemic inflammation. Many studies like this one from the Journal of Crohn's and Colitis support this idea of gut imbalance. Gut dysbiosis refers to an unhealthy imbalance of good and bad bacteria in the digestive system. Things like antibiotics, environmental toxins, stress, processed foods, sugar and low fiber can kill off the friendly gut bacteria. That is why it is advisable to take probiotic supplements and eat fermented foods that contain lots of friendly gut bacteria, such as plain yogurt, kefir, and kimchi. They can help restore the friendly gut bacteria. While promising, fasting is not a one-size-fits-all intervention. Some considerations include the risk of nutrient deficiencies, as long-term fasting without proper planning may deprive the body of essential nutrients required for skin repair and immune balance. Stress response in some individuals, especially those with adrenal dysfunction, prolonged fasting may trigger stress and worsen symptoms. Medication timing, patients on immunosuppressants or insulin may need to adjust dosages while fasting to avoid complications. Fasting may offer particular benefit for psoriasis patients with metabolic syndrome or insulin resistance, or overweight or obese individuals with high systemic inflammation, and patients with mild to moderate psoriasis or irritable bowel disease looking for complementary lifestyle approaches. However, patients with complex autoimmune conditions, eating disorders, or a history of hypoglycemia should consult a healthcare provider before attempting fasting. Fasting and intermittent fasting show real potential as supportive therapies for psoriasis by lowering systemic inflammation, modulating immune responses, and restoring gut microbiome balance. While more large-scale clinical trials are needed, early findings and case studies are very promising. People interested in trying intermittent fasting should do so under medical supervision, especially if they have other underlying health conditions, ideally with the support of a nutritionist or integrative dermatologist. It often starts in the gut. In fact, it is sometimes thought that most chronic illnesses, especially those caused or aggravated by inflammation, have their true cause and roots in poor digestive health. Whether it's dysbiosis or leaky gut syndrome, the answer often lies in better gut health, and fasting may be a piece of that healing puzzle. So, until next time, good luck on your journey to better health. And remember our motto: to be well, we must think well, eat well, and move well. Take care.
Thanks for watching our video. And if you like it, please hit the like button and give us a thumbs up. So until next time, be well, stay safe, and stay positive. Take care.